Hi, so today my team and we are going to explain our telemedicine service proposal, which is a computer science used for prediction and automation of oncology diagnosis. So the name of our application or our system is Oncaid. First, we already know that cancer is associated with a significant morbid mortality globally. Advances in screening, diagnosis, management, and survivorship were substantial in the last decade. However, challenges in providing personalized and data-oriented care remain important. That's why, by now, we are needing a potential solution to improve the healthcare journey and to promote a precision in healthcare. So we as a team decided to create an innovative solution with the conjunction of recent back services, telemedicine, and AI application, which is artificial intelligence. All of this in the same system. Let me introduce you with our system. So normally the patient will go to a specialist. Let's imagine an adenocarcinoma case situation. So the patient normally will be asked to do an endoscopy, a biopsy, and a CT scan of chest and abdomen. And normally each result of these exams, of this test, will be obtained by different specialists. And these different other specialist will give the result to the patient. The patient has the obligation to give the results to the specialist. This is a little bit complicated because maybe there can exist some errors. It can exist an overlap of, it may exist the possibility that the diagnosis will not be as early as possible. So we as a team decided to create a network, a system where all of these characteristics can be in one same place. It means that the specialist will ask the patient to do an endoscopy, a biopsy, and a CT scan of the chest and abdomen. Also, the medical specialist will create its electronic medical record and its physical examination. And all the results will be in the same place, in any moment, in anywhere. And all of these results will have the capacity to be in a medical record in which will be analyzed from a neural network process. And this neural network process will have the knowledge server. It means the knowledge server will allow the medical specialist to analyze all the information, and the neural network will give some differential diagnosis, therapy responses, the survival and disease recurrency, the prognosis, and also will allow a medical monitoring and a telemedical monitoring. But not only that, if the patient needs other clinical attentions, other health attentions such as nutritional or psychological, the same neural network will allow the specialist to analyze which other specialists are important for the case, for the patient. So all of this will be in the same place, which will help the patient to have all its information in a portable interface. It means it can be in its phone, it can be in his iPad, or it can be in his computer, and it's the same for the medical specialist. It can be anywhere, anytime, and it will help the medical specialist to make better diagnosis, to have a better treatment response, to have a better analysis of the case. And also, we don't have to forget how does all this storage, sorry for the translation in here, but how does all the storage will be in the same place? It means it will be secure and it will have the necessary privacy for the patient information, and it will be in a great amount. All these great amounts of information will be safe in the same place, in the same storage. So the clinical aspects that are involved on this is that we are working with telemedicine, recent back services, and AI application, all of this in oncology. It means that it will require optimization of cancer research, also the improvement of clinical practice. Other analysis is that we need a better prognosis and response, and there exists current limitation and future perspectives in this topic. And talking about the financial aspect, it is a common misconception that AI costs a fortune and it's only for the tech giants like Google, Facebook, or Microsoft. And improving computer power actually have made it affordable to all organizations in the last decades. The variation of the cost results from the level of intelligence, the amount of data that will be required on the application, and how the algorithms need to be performed, as well as the technology itself varies with some considerations that feed into cost of implementing artificial intelligence in healthcare. So there exists a variety of challenges and scopes that can be named as barriers. And these barriers include some limitations in data collection and training, and also in the scarcity of prospective clinical validation, difficulties in user education and ethical regulatory guidelines, and also the challenges to the data range accuracy to the relevancy of the information assembled. Now talking about the training to operate the system, the data captured from oncology providers and healthcare systems are complex and diverse. Normally, doctors type or dictated notes, laboratory finding, histopathological and imaging data, and patient-generated health data are examples of the unpredictable or the unpredictability of the information captured. So crude medical data are often of limited relevance. Thus, obtaining meaningful clinical insights and analytics relies on adequate data extraction, processing, analyzing, interpretation, and integration. There is a relative ignorance of the medical community related to artificial intelligence and its methods of application. So that's why the education of all the stakeholders, including patients, providers, business administrators, is necessary so that advances can be translated into a higher quality care. Seamless integration of any new tool into clinical workflow is critical, and yes, we also do not have to forget that to highlight the ethical challenge with artificial intelligence, telemedicine, and recent back services in healthcare. So it is imperative to address these ethical issues related to use of patient data in unwarranted and unconsented circumstances, while respecting ethical policies and guidelines that are designed to protect the patient safety and privacy. So that's all from the presentation. Here are the references. I hope that I help a lot to understand a little bit of our project, and see you. Thank you for watching.
Some of the appropriate behaviors we will include in our telemedicine service are to give appropriate training and education on how to use the service and recognize clear goals, objectives, and expectations. We are going to make sure that the space in which the teleconsults are given are private spaces, have good lighting, and also that the professionals eliminate actions that can distract viewers, simulate eye contact by looking up to the camera, and project their voices. Also, they're going to dress and act professionally, and create a pause before responding to the comments or questions of patients. We are going to also follow appropriate regulations, including credentialing and licensing.
An important aspect to take into consideration for the implementation of telemedicine services is the aspect of cybersecurity. It is very important to be aware of the legal responsibility of safeguarding protected health information, or PHI, that this modality carries. The HIPAA privacy rule establishes national standards to protect individuals' medical records and other personal health information, and applies to health plans, healthcare clearinghouses, and those healthcare providers that conduct certain healthcare transactions electronically. It is important to answer multiple questions to ourselves about the functioning of our system in order to be conscious of its security regarding the access of ePHI, electronic protected health information. The most relevant questions will be: who has access to it? From where? How easy it is to modify the information? What backup plans do the database has in case of an emergency? How resistant is the program to hackers? Can one identify who made modifications on the database and how easily? Another important point is that those who have access to the database are capable of using it properly and know the risk of sharing private information. The team then must be trained in confidentiality and aware of possible risk or scams. And they, of course, must preferably be trustworthy.
A health information system, according to the World Health Organization, is responsible for more than monitoring and evaluation, as it is also effective at supplying early warning capability, management of health resources, careful planning, supporting and encouraging research, examination of health trends and current circumstances, aligning international broadcasting, and boosting intercommunication of health challenges. Furthermore, health information systems are in charge of providing the gathered information and data in layouts and schemes that are beneficial for the stakeholders and decision-making leaders, such as policymakers, administrators, healthcare professionals, or even communities.
Health information system is the most essential component of our proposal, since our idea, as explained before, is based upon the data communication and its use for analysis. The main benefit that our proposal and its use of HIS has is that it is effective in facilitating the communication of flow of information. It searches to be as efficient and quick as possible in order to give the patient an opportune result and in this way treat them properly and in time. It intends to be a patient-centric approach in which the specialists work together, facilitated by the health information system to provide safer, timely, and accurate results.
The vendor we would choose would be the Epic Systems Meditech, since they were considered the top vendor of the year 2015 by the HHS Office of the National Coordinator for Health Information Technology. We would acquire the features of the very notifications as for the doctors and for the patients of the arrival of test results, a warning of contraindicated medications, and such other notifications for the benefit of the patient and the efficiency of the doctor. Another feature we would acquire would be the use of scribes to allow the physicians to focus only on the patients and not on the administrative paperwork. These features are meant to help both the patient and the physician so that their care may go as efficiently as possible. Considering the information obtained by the Emergency Care Research Institute and the criteria given in the comparative table, we chose the Philips Healthcare View PACS as our PACS vendor. This manufacturer proves to have the newest operating system and can offer us upgrades included in maintenance contract, together with a range of options for long-term storage. Some features that made our decision easier are that it includes 3D image processing and specialist physician tools such as volume rendering, vessel analysis, cardiac analysis, PET and CT, and volumetric anatomical registration. This manufacturer also provides integrated report dictation to create interactive multimedia reports and provides us with radiologist-specific web applications with image display and manipulation. The uptime guarantee of this manufacturer is more than 99% and covers the suggested time for warranty of 1 year. The patients we are targeting with our telemedicine practice are cancer patients. The way we plan to target these patients with our telemedicine practice is with the use of optical sensing in smartphones. As explained in the article by Burahev Purohit, there is a smartphone assisted device that can detect ALP alkaline phosphatase concentration using RGB detection. It specifically detects ALP concentrations with the color red. These readings are relevant since it has been seen that ALP concentrations are cancer biomarkers. This is how this service would be helpful to us when providing this telehealth service to cancer patients.